Hello everyone, welcome back to my YouTube channel after so long time. Here I came back with a new series of question discussion about the previous year questions of NEET PG and INI-CT. See guys, the each and every competitive examination for postgraduate medical entrance courses in India, the gold standard thing and the basic and primary thing is to master the previous year questions and previous year topics. Uh, Before November 2020, there is a separate examinations for central institutes like AIIMS, JIPMER, PGI Chandigarh or NIMHANS. But after November 2020, they have introduced a single exam for central institute that is called as INI-CT. But before November 2020, there are different examination for AIIMS, for JIPMER, for NIMHANS, for PGI Chandigarh, and for state institutes there is a NEET PG. So now there is only two examination for entry into the postgraduate medical courses, that is NEET PG and INI-CT. Uh, I will start my discussion with anatomy subject and the very old examinations, that is AIMS 2017. And then I will try to cover of these postgraduate medical examinations and we'll discuss previous year questions of each and every year of each and every examination and cover each and every subject. So our first subject is anatomy AIMS 2017. So let us start discussing the previous year questions. So our first question is nucleus pulposus is derived from. So first of all, let us label this figure. So the first structure, that is number one, that is notochord. The second structure, that is ectoderm. The third structure, that is endoderm. And the fourth structure, that is intraembryonic mesoderm. So the actual derivative of nucleus pulposus from the embryology part of your study in the first year of MBBS, the answer is notochord. So the nucleus pulposus is derived from notochord. The second question is what is the origin of fibers marked by the arrow? So this one is the arrow marked. So this arrow indicates fornix. What is the origin of fornix and what is the site it will end? So actually the fornix derives from the hippocampus and it will end into the mammillary body of the thalamus. So the origin of this fiber, the answer is hippocampus. Among the following, what is the function of the marked muscles? So actually the muscle marked is lateral pterygoid. So the function of the lateral pterygoid to depress the jaw, to open the mouth. So the answer is A, depression. The fourth question is, which of the marked foramen does the mandibular division of trigeminal nerve pass through? So first of all, let us label the marked foramens. The first one is foramen spinosum. The second one is foramen ovale. The third one is internal acoustic meatus, and the fourth one is jugular foramen. So mandibular division of trigeminal nerve, you can remember the structure called as males. Male structure passes from the foramen spinosum. So that is mandibular division of trigeminal nerve, accessory meningeal artery, laser petrosal nerve, and imagery vein. So the answer is A. The fifth question is the structure marked with the asterisk in the electron micrograph indicates. So this one is asterisk and this one is arrowhead. Let us label this structure. This one is secretory vesicles. This one is postsynaptic density, and these all are postsynaptic cells. So the answer of asterisk labeling is secretory vesicles. Let us move on to the sixth question. In the image given below, identify the muscle responsible for the opening of the mouth. First of all, let us label these all four alphabets. This one is temporalis. This one is masseter. This one is lateral. Very good. And this one is medial pterygoid. So the muscle which is responsible for opening the mouth is actually lateral pterygoid, labeled as B. So the answer is B. Identify the structure passing through the foramen marked. The foramen marked is a superior orbital fissure, and the structure passing through that superior orbital fissure is abducens nerve. Because other three structure, let us discuss about where they pass from. The spinal accessory nerve passes from the foramen magnum. Ophthalmic artery passes from the optic canal, and middle meningeal artery that will pass from the foramen spinosum with mandibular branch of trigeminal nerve. The talocalcaneonavicular joint is the type of ball and socket joints. This is a very simple and straightforward question. Which of the following is connected to the structure marked as A in the image given below? This one. First of all, this is a part of corpus callosum. So let us describe different parts of corpus callosum. This one is rostrum of corpus callosum. This one is genu of corpus callosum. This third one aerostructure part is body of corpus callosum. This one is isthmus of corpus callosum, and this one is splenium of corpus callosum. In this part, middle part is septum pellucidum. So this labeled A part is splenium of corpus callosum, and splenium of corpus callosum is connected to the striate cortex. The structure passing through the central tendon of diaphragm. So the thing is, central tendon of diaphragm have only one opening. That is vena cava opening. That pass inferior vena cava as well as vagus nerve. So the answer is inferior vena cava. The shape of trapezius muscle is simple, it is triangular. All of the following are true about gray rami communicates, except. Let us discuss the difference between the white rami communicates and gray rami communicates. The white rami communicates are preganglionic, while the gray rami communicates are postganglionic. White rami communicates are myelinated, while gray rami communicates unmyelinated. White rami communicates are having a neurotransmitter called as acetylcholine, and gray rami communicates having the neurotransmitter that is noradrenaline. So let us explore the options. Gray rami communicate is myelinated, absolutely right. Uh, Gray rami communicate is connected to spinal nerve. This is also right. Gray rami communicate is preganglionic. This one is wrong. And gray rami communicates present medial to white rami communicates. This one is true. So the answer is C. Which of the following represents a holocrine gland? Let us discuss each and every image. The first image is A, which is a sweat gland. The B image is sebaceous gland. The image C is an image of mammary gland, and the image D is an image of ceruminous gland. So which of these is an holocrine gland? This is the question. So let us discuss the types. The sweat gland is merocrine or eccrine type of gland. Sebaceous gland is a type of holocrine gland. Mammary gland and ceruminous gland is a type of apocrine glands. So the answer here of holocrine gland is B, that is sebaceous gland. Question number 14. Which of the following structure marked in the below image gives rise to the heart in an adult? Let us label all these four structures. The D is yolk sac. There is developing brain. The C is developing heart. The B is spinal column. So the answer here is actually C, because C is actually the heart bulge which develops the heart in the fetus. Question number 15. A 58-year-old woman was undergoing cholecystectomy. During the procedure, the resident accidentally advanced the scissor along the superior border of the epiploic foramen, causing injury. Which of the following structure is likely to be injured? The thing is, superior border of epiploic foramen is related to caudate lobe of liver. The answer is C. Question number 16. Which of the following structures does the cell pointed in arrow inhibit? So this structure is actually the Purkinje cells, and Purkinje cells inhibit the deep nuclei of the cerebellum. The image below shows the insertion of transversus abdominis muscle. Identify the conjoint tendon. So let us label all these four structures in this figure. A is lumbar fascia, B is transversus abdominis, which is muscle. C is conjoint tendon. The D is inguinal ligament. So the conjoint tendon is the option C. What represents the marked area in the given histology of lymph node? So let us discuss all different structure which is present in this figure. This one is mental zone. This one is germinal center. This one is paracortex. And this one is capsule. So the answer is D, because this labeled structure is mental zone. A young patient presented with hypothyroidism, absent thymus, and tetany. Which of the following marked areas in the picture is defective in this condition? Let us see the picture. This is a picture of pharyngeal arches and pouches. So let us again see the question. Hypothyroidism, absent thymus, and tetany. So inferior parathyroid develops from third pharyngeal pouch, as well as thymus is a derivative of third pharyngeal pouch. So the actual answer of this question is C, that is third pharyngeal pouch. Because there is no thymus, so we can easily assume that there is a defect of third pharyngeal pouch formation, and that will lead to absent thymus. A patient came with complaint of inability to move his fourth and fifth digit, cannot hold a pen, and he was not able to hold a paper between fingers. Which of the following sites given below is the probable cause of injury to the nerve in the question? First of all, this scenario talks about the injury to the ulnar nerve because the patient is unable to move his fourth and fifth digit, cannot hold a pen, and not able to hold a paper between the fingers. So the injury is ulnar nerve. This one is actually the head of humerus. This one is shaft of humerus. This one is lateral epicondyle of humerus, and this one is medial epicondyle of the humerus. So ulnar nerve actually passes through the medial epicondyle of the humerus. So here answer is C. Which of the following structures of the scapula is palpable in the infraclavicular fossa? So let us first label these all four alphabets. This one is coracoid process. This one is acromion process. This one is glenoid cavity. This one is inferior angle. So the answer here is A, that is coracoid process. Because when you start to palpating the infraclavicular fossa, the structure that will palpable to you is coracoid process. The 22nd question is identify the pelvic diaphragm from the image given below. So let us label these over four structures. The A is pelvic diaphragm. The B is external anal sphincter. The C is internal anal sphincter. And the D is pudendal canal. So the answer here is A. The 23rd question is what is the root value of cremasteric reflex? This is a simple, straightforward, and fact based question, and the answer is A, that is L1, L2. It is the root value of cremasteric reflex. So, with this, we have completed the recall questions of AIMS 2017. See, guys, previous year question are the gold standard thing. You can derive previous year topics, which topic you have to more focus on, as well as which topic are the most important topics that you should focus on your upcoming examinations. So, thank you so much for watching. See you in the next one.